Hi there, my name is Lori Bossum of A Balanced Life, Greenville, South Carolina, and this video is on why I use evidence-based therapy. Now, most of the people that come to therapy for the first time are really not aware that there are significant differences in the types of therapy used in the helping professions. I think it's important to educate yourself about the various types of therapy before you hire a therapist. Most people would never think of going to an ear, nose, and throat specialist for a tummy ache, but could easily wind up in an ineffective therapy without the proper knowledge and understanding. As a dedicated, passionate therapist of 20 years, I chose to pursue and gain in-depth training, knowledge, and understanding in the types of therapy that will help those I work with make cost-conscious, lasting change in the shortest possible time. The differences in the evidence-based therapy over what is referred to as therapy as usual are that with evidence-based therapy, the specific techniques and skills have been rigorously tested and proven in randomly assigned trials to work better than medication, placebo, or treatment as usual. The results can be repeated in a variety of settings with a range of different types of people, and the therapist has been sufficiently trained in and adheres to fidelity of the evidence-based model. Now, in other words, evidence-based treatment is based on what works, not just what feels right or has worked in the therapist's personal life or is the latest pop psychology fad. The leading evidence-based therapy in the helping professions is cognitive behavioral therapy, CBT for short. Now, cognitive behavioral therapists are invested in providing you with the skills and strategies that not only help you feel better in the moment, but also help you to do and cope better in the long term. The basic premise behind CBT is that our learned behaviors and emotions are the direct result of our thoughts. For example, it's been proven that panic attacks arise from thoughts of anxiety about your anxiety. Cognitive behavioral therapists use purposeful questioning and evidence gathering alongside examining the validity and the utility of your thoughts as mechanisms for change. We also collaborate with you to establish concrete and measurable goals for your therapy. CBT has been proven highly effective in helping people who struggle with anxiety, depression, and anger. When you choose non-evidence-based or therapy as usual therapists, you run additional risk of treatment failure or a much longer course of treatment, decreased likelihood that you'll return to therapy if symptoms persist, an increase in the symptoms over the lifetime, and an increased risk of insurance companies denying claims for therapy. Thank you so much for taking the time to watch this video. I hope that it's answered some questions for you and possibly even made you interested in exploring evidence-based therapy and cognitive behavioral therapy further. A really good place to start is the National Institute of Mental Health's website. If I can be of any further assistance, or you have questions, comments, or would like to schedule an appointment, feel free to either email me or call me directly. In the meantime, be well.